I'm going to be showing you how to pull an arterial sheath from a femoral artery on a patient using my hands. I'm going to go wash my hands first. I've washed my hands, so now I'm going to go ahead and introduce myself to the patient. Hello, Mrs. Smith. I'm Ashley. I'm going to be pulling your line today. First, I'm going to have to go ahead and get some supplies. I'll be back with you in just a minute. Our supplies includes 2 pairs of unsterile gloves, a mask to protect our eyes, our mouth, and our face from any blood spatters, a gown to protect our clothes, a pair of sterile gloves, a pack of iodine swabs to clean the site, 2 boats of 4x4 sterile gauze, a collagen hemostasis patch, a scalpel in case we have a suture to cut, and a clear dressing. Okay, so I'm all suited up. For a real line pull, I'd be using a mask, but for video purposes, I'm not going to, so that way you can hear me talk. Now, I've already reiterated to the patient what I'm going to be doing, and during a real line pull, I would keep doing that throughout the entire procedure. But for the video, I'm going to try to speak just to the audience. I've got the area where the line is exposed. I've also covered the patient's peri area. Now I keep the leg all the way down to the foot exposed so that way I can see if there's any change in color, also called mottling. I'm going to be taking off the sock here so that way I can feel the patient's pulse and see the color of their foot. I'm going to begin by feeling the patient's pulse. It's really good. I'm going to begin by telling the patient what I'm doing as I pull off their dressing. While I do this, I'm trying to make sure that I don't give the patient any markings on their skin by being very gentle. I also don't want to pull on the line, which you can see is now exposed. Now I'm going to feel where the patient's pulse is. I found the pulse. Then I'm going to touch the patient's pulse on their foot to see how much pressure I need to occlude it. I'm going to pull back about 10 cc's of blood from the line so as not to strip a clot from the line as we pull it. To get started, I'm going to open up my iodine swabs and use one swab around the site from inside to the outside to keep any bacteria from getting inside where the line is. I'm going to leave the other 2 swabs for in a moment. To cut the suture, I'm going to lock the scalpel into place and go up while cutting so as not to cut the patient.
Go.
I lock the scalpel back and put it into the sharps container. I'm now using the remainder of the swabs to clean from the inside out. This is preventing from any infection. Now I'll open my sterile gloves. I'm going to be careful not to introduce any bacteria into my sterile field. I'll now open up my hemostasis patch. Being careful not to get it anywhere except for my sterile field, I'm going to put it next to my gloves. After allowing the betadine some time to kill any bacteria that may be on the site, I will go ahead and dry the remainder of the betadine left while keeping the area sterile using my sterile gauze from the inside out. The reason why we dry the area is to keep my hands, or if we're using a clamp, from slipping. Before applying your sterile gloves, remove your soiled ones first. Then wash your hands or use the alcohol-based sanitizer, and then you can go ahead and apply a new pair of unsterile gloves. I will now apply my sterile gloves. I'm going to touch just the cuff, which will be unsterile in just a moment. And being careful to touch anything else, I'll put them on. This glove is sterile. I'm now able to touch this glove at any place because it's all sterile. I choose to go in the cuff so that way I can easily insert it onto my other hand. I'm going to make sure that I have the pulse. It's right where I had it before. Now I'm going to pick up my sterile hemostasis patch and put it underneath my fingers and the site. I will now pull the line. So I've already reiterated to the patient that there will be lots of pressure and to keep their stomach nice and still and relaxed. I have the patient completely flat. In a real line pull, we will have them hooked to a monitor that also has their O2 saturation and blood pressure every 5 minutes. Now I'll pull the line. Nice and slowly. And at the end you'll feel just a little bit when it's coming out, and that's when you hold the most pressure. For a collagen hemostasis patch, I will have to let it bleed just a little bit to leave an area where it can actually form a clot.
Go.
During this time, I'm going to keep a close eye on how the patient's vitals look and the color in their leg, as well as checking the site for any hematomas. Make sure it's not hard or the patient feels no pain. I'll also be checking the pulse in the foot to make sure that the patient has sufficient blood flow. For the first few minutes, I'm going to hold the most pressure, and I'll be letting up slowly as I go. For a handheld line pull using a collagen patch, we will hold approximately 10 minutes of handheld pressure to achieve hemostasis. I've got the bed at a perfect level for me. I'm 5'3". I need to make sure that I can hold pressure without using my fingertips so as they do not fall asleep. It can be quite painful, and I may not realize exactly how much pressure I'm holding. I want to keep my shoulders very relaxed. I can use my arms extended to hold the pressure, therefore applying it using my body weight. My 10 minutes is up. I have been monitoring the patient's blood pressure and checking on the pulses in their foot. Everything looks great, even their leg and the color that it is and was before. I've been coming up slowly on the patient's artery. I'm now holding little to no pressure. Using my other hand, I'm going to assist my left hand in coming up off the artery as it may be stuck to the iodine. And we want everything to be nice and gentle so as not to disturb our newly formed clot. The site looks great. If your patient complains of any pain or there's any change in some of their vital signs, you should tell your nurse right away.
Action.
I'm going to apply a clear plastic dressing to prevent any bacteria from entering the site. Circle the amount of blood that was needed to activate the collagen patch. You will need to have it there so you may come back and know if there's any difference in the amount of bleeding. So that's it for the handheld line pull using the collagen patch. If you had no order for the hemostasis patch, then everything for the procedure would be exactly the same, except you just wouldn't use it. And you would hold 15 to 20 minutes of handheld pressure instead. At the end, you can go ahead and apply a little dab of betadine ointment to the site and apply a clear plastic dressing if needed. After finished with your line pull, you should teach to your patient everything that they need to know to keep them safe during their recovery hours. Now, I'm going to let Mrs. Smith know that she may be on bed rest from anywhere to 2 to 4 hours, sometimes 6 if they've had intervention, depending on the doctor's orders, of course. Also, they're going to be laid flat for at least the first 15 to 20 minutes. Then we can go ahead and raise them to about 30 degrees, no higher than that. The patient's going to need to keep their right leg, if that's where their line was, or their left leg, straight the entire time. They will need to know to hold pressure on the site where our bandage was if they need to sneeze, laugh, cough, burp, pass gas, or use any of their abdominal muscles during this time. Also, they will have their call bell right in front of them, so they may press the red button to get a hold of their nurse, or anyone for that matter, if they are bleeding or feel any warmth or discomfort. If you have any questions, please contact your friendly educator.